My name is Felix Chan. I'm a gynecological surgeon. I work at Adventist Hospital. In the management of gynecological cancer, surgery carries a very important role. Looking after women who suffer from this condition for many years. We look after the patient, ladies, holistically. Look after the psychological impact of the disease. Define the extent of the disease. Provide the patient with hope and management plan. We provide psychological support to patients after the diagnosis of disease and provide them with a treatment plan, which could be surgery, radiotherapy, or chemotherapy. That's where the robotic surgical system comes in. The XI system allows us to make a diagnosis of the disease, allow us to define the extent of the disease, but also perform surgery to remove the disease. This helps us to tailor our management so that we don't overtreat patients or undertreat patients. Every disease has its own biology and characteristic. It is exciting to be able to have a surgical system be able to deal with disease of different type, disease of different aggressiveness, disease which is spread to different parts of the pelvis or the abdomen. This surgical system allows us to define whether disease has gone to the lymph glands, whether it's traveled to the lining of the pelvis, whether it's traveled from right side to the left side, whether it's traveled to the lymph glands higher up in the abdomen, and to see whether it's traveled to the bowel or the bladder. This information helps us to remove the disease at the time of the operation, but provide a complete package for women so that we can actually individualize treatment afterwards. Managing gynecological cancer is very special. I have the privilege to look after many women who suffer from this condition. They rely on me, rely entirely on me, my hands, to be able to perform the surgery. I feel privileged to be able to do that. Over the years, I've developed a lot of experience through open surgery, vaginal surgery, and traditional laparoscopic surgery. It has helped a lot of women that I look after. But over the last 6 years, I've taken on robotic surgery. This type of surgical approach allows me to be able to perform the surgery with more precision, more stability. That means that I am able to produce precision surgery every time I'm operating. Regardless what my days are like, regardless how difficult and complex the situation is, I give hope, opportunities, and be able to remove the disease and produce a better outcome for the patient. From my experience, patients spend less time in the hospital, spend much less time in the hospital. The standard hysterectomy through an open incision, patient might stay in the hospital for 7 to 10 days. While the robotic approach, some patients only stay for the day. Some go home within 24 hours. Why? There's less trauma, there's less bleeding, there's less injury to the normal tissue. The incision is small, there's less risk of readmission, there's less risk of wound infection and reoperation. This is what surgery is all about.